Welcome to Angel Health Academy. Subject Community Health Nursing. Topic for the day is Occupational Health Nursing Part 3. I have already uploaded 4 videos of Occupational Health Nursing, that is Part 1, which consists Introduction, Definition, Aims, Objectives and in depth and in detail about occupational health hazards. Then second, I have been uploaded 3 other videos of Part 2, that is Session 1, Pneumoconiosis and its classification. Session 2, Organic Dust related pneumoconiosis, and Session 3, Inorganic Dust related pneumoconiosis. If you have not watched and seen that video, please refer and watch that video first, then you come back to the today's video. In this video, I will be explaining in detail about prevention of occupational diseases, which is an important short note or important question for you. Then I am also explaining about the measures for health promotion and protection of the workers. In the next session of the video of Part 3, I will be explaining in detail about role, responsibilities and functions of a community health nurse in occupational health nursing. So let us discuss first prevention of occupational diseases. There are mainly 3 measures to prevent the occupational diseases: medical measures, engineering measures and legislative measures. Medical measures, engineering measures and legislative measures. Let us discuss in detail each measures. First one is medical measures. I have made a mnemonic for the medical measures. So sometimes you may feel difficulty to understand this, but after explaining every point of medical measures, it will be easy to understand and remember the mnemonic. The same point I have included in the mnemonics. So the mnemonic is: after pre-placement examination of workers in medical and healthcare services, the dates for periodical examination and health education is notified, then supervised their work and recorded. So let us expand this mnemonic in detail. That is, the medical measures consist of 7 measures. First one is pre-placement examination. Second one is medical and healthcare services. Third one is periodical examination of the workers. Fourth one is health education and counseling. Fifth one is notification. Sixth one is supervision of work environment. And last one is, seventh one is record maintenance and analysis. So there are 7 measures under medical measures for the prevention of occupational diseases. They are pre-placement examination, medical and healthcare services, periodical examination, health education and counseling, notification, supervision of work environment of the factory or industry, record maintenance and analysis of the data. So let us discuss one by one. So first one is pre-placement examination. Pre-placement examination nothing but it is an examination of the employee or workers before or just at the entry of the organization, that is industry or factory. So thus it is done at the time of the employment, at the starting time of the employment, which includes history collection of the worker, physical examination of the employee, hematological or blood examination of the employee or worker, then radiological or X-ray examination. The result of this examination is used as a useful benchmark for the future comparison of the health status of the employees. So here we detect any possibility or risk for the employee to have a particular occupational diseases, and also analyzes basic health status. So the result of the pre-placement examination will be useful as a benchmark or the reference details for the future comparison of the health status of the employee. Second is medical and healthcare services. So providing needed medical and healthcare services to the employee, thus we can prevent the occupational health diseases such as ESI services, employee state insurance services to the employee, then factory first aid services to the employees in the working situation or working settings, then immunization that is needed according to the situation, according to the exposure of the or according to the number of diseases occur in the factory or industry. So medical and healthcare services includes ESI services, first aid services and immunization to the employees or workers. Third measure under medical measure, that is periodical examination. So conducting periodical examination That may be once in a year, once in 6 months, once in 3 months, or monthly, etc. So the frequency and content of the periodical examination depend upon the type of the occupational exposure and the industry and the factory. So frequency and the content of physical examination depend upon the type of the occupational exposure in that particular industry or a factory. That means it varies from industry to factory. Generally, periodical examination conducts once in a year, but sometimes it may be needed monthly exam or even daily exam. That all depend upon the exposure chance in the industry or a factory. So it varies according to the exposure chance in the industry and the factory. Fourth measure is health education and counseling. So ideally, health education and counseling also start before the employment. The content of the health education and counseling includes all the risk involved in the industry or factory will be would be explained to the workers before he start to join that particular factory or industry. Then measures to be taken for personal protection. So what are the personal protective measures available and how it has been taken during the emergency or in the daily routine. Then the correct use of the PPE, that is personal protective equipment and protective measures in the industry or factory. The last one is the simple rules of hygiene, what is necessary to practice in the work settings. Thus, health education and counseling consists all the risk involved in the factory or industry, various measures to be taken for the personal protection of the employee or worker, the correct use of the PPE, that is personal protective equipments, and the other protective measures in the industry and factory, and following the simple rules of hygiene practices in the industry and the work settings, etc. The fifth one is notification. So notification of the cases and suspected cases in the industry or factory immediately, thus to prevent the spread of the infection in the industry or factory. So the cases and suspected cases or people risk and prone to get that particular problem should be notified early. The notification also includes supervision of the working environment. So supervision of the working environment daily or weekly, monthly, depends upon the situation. Then periodical inspection of the working environment by the physician and other health team members. So that is periodical inspection of the working environment, and periodic visit and checkup of the employees or workers by the physician. All should be comes under notification. So notification includes early information regarding the detection and information regarding the cases and the suspected cases, supervision of working environment, periodical inspection of working environment, periodic visit and checkup by the physician in the industry or factory. Then sixth measure is supervision of working environment. Supervision of working environment, that is a factory or industry or the field, includes water supply, food, general plant cleanliness, that is housekeeping, then toilet facilities, proper garbage and waste disposal in the factory or industry, then sufficient spaces for the activities of the employees, then adequate lighting, adequate ventilation, and protection against hazards with the PPE, that is personal protective equipment, and other measures in the industrial factory. So this would be supervised in the working environment. So supervision of working environment includes water supply, food, general plant cleanliness, that is good housekeeping in the industry and factory, toilet facilities, then proper garbage or other waste litter disposal, then sufficient or adequate space for the employees for the activities, lighting, ventilation, and protective measure, that is protection against hazards with PPE and other protective measures in the industry and the factory. All must be supervised. Then seventh point, last point, is records maintenance and analysis of the data. Record may be varies according to the industry and factory. All must be maintained properly and it should be updated periodically. So proper maintenance of the occupational record of each employee or workers. So maintenance and update of the workers' health record and disability record, etc. Then periodically the information or data of the worker or employee has to be analyzed, and thus early detection could be done, and thus the preventive and control measures has to be taken. So these are the 7 important measures under medical measures to prevent the occupational diseases. I think now you can better understand the mnemonic for the medical measures, that is after pre-placement examination of workers in medical and healthcare services, the dates for periodical examinations and health education is notified, then supervised their work and recorded. So which includes pre-placement examination, medical and healthcare services, periodical examination, health education and counseling, notification, supervision of the work environment, and last one is record maintenance and analysis. So there are 7 medical measures. The second main measures to prevent the occupational diseases is engineering measures. Engineering measures. Let us discuss in detail about engineering measures with the mnemonic. Engineering measure also I am going to explain with the mnemonic. In that also same factors or activities have been included. That is designing local exhaust fan, LEF, in housekeeping is a substitute of mechanical ventilation for dust control and act as protective device to enclosure the isolated environment is statistically proved by research. So this is the mnemonic for engineering measures. So now you may be confused with the mnemonic, but all the activities or measures comes under engineering measures. I have been explained and connected with this mnemonic. At the end of the session, you can understand better. So let us expand this mnemonic under engineering measures. So there are 13 measures to prevent the occupational diseases under engineering measures. First one is design of the building, that is design of the industry or factory. Then local exhaust fan, good housekeeping, substitution, mechanization, general ventilation, dust control, protective devices, use of PPE, enclosure, that is covering, isolation, environmental monitoring of the environment of the factory or industry, statistical monitoring, that is analysis of the data information, and conducting various continuing research in the industry or factory to detect the early symptoms of the occupational diseases. So first one is design of building, second one is local exhaust fan, third one is good housekeeping, fourth measure is substitution, fifth one is mechanization, sixth one is general ventilation, seventh one is dust control, eighth one is protective devices, and ninth one is enclosure, 10th one is isolation, 11th one is environmental monitoring, 12th one is statistical monitoring, and last one is 13, that is research. Let us discuss in detail about all these 13 measures under engineering measures. The first measure is designing of the building, factory, industry before it construct. Designing of building is a measure to prevent the occupational health diseases. So before we construct a factory or industry, we would plan and we would make certain measures to prevent the occupational disease based on the particular industry or factory. And that means it should commence in the blueprint stage of the factory or industry. So it should commence in the blueprint stage. Then based on that, building should be designed. So that should be applied in the floor, roof, walls, doors and windows of the industry or factory. So the type of floor, the types of roof, types of walls, doors, windows, etc. all must be based on the plan during the blueprint stage. Thus we can prevent the number of occupational diseases in the industry or factory. Then once it is constructed, the industry or factory, then we cannot alter. It is difficult to alter. So before it construct only, it has to be well planned to design the factory or industry to prevent the occupational health diseases. Second is local exhaust ventilation, use of local exhaust ventilation or fan. So the dust, fumes and other injurious substance from the factory or industry can be trapped or collected and extracted at source. We can convert at the source, extracted at source before they left or let escape into the factory atmosphere. So the employees or workers who belongs to that particular industry may be exposed to for a prolonged period with the chemical which is emitted by the industry or factory. So to prevent the occupational diseases to the employees, the dust, fumes and other injurious substances that might be emitted from the industry or factory can be trapped and extracted at source by use of local exhaust ventilation before they emit or escape into the factory atmosphere. And they can maintain the permitted level of the concentration of this chemical, dust or chemical substance which emit from the factory or industry. So that is about local exhaust ventilation or local exhaust fan. The third point is maintaining good housekeeping in the industry or factory, which includes general cleanliness, ventilation, lighting, washing facilities, etc. Cleanliness, ventilation, lighting, adequate ventilation and washing in the industry or factory. Then whitewashing of the industry or factory once in a year. So the factory or industry has to be whitewashed at least once in a year to maintain the cleanliness. Then use of vacuum cleaner that prevent the spreading of the dust. Then cleaning must be done by a wetting process. So use of vacuum cleaner or by wetting process to prevent the or remove the dust from the industries. Then protective equipment PPE should be kept clean and good repair and good working condition when it is necessary in the emergency. So keep the protective equipment clean and good in condition, that is good repair and condition. Then right things at right place. So all the things in the factory must be kept or industry must be kept at the right place, and in emergency it could be easy to handle if the things are in the right place. Then both inside and outside of the industry or factory should be kept clean and make it tidy. So these are some of the measures for the good housekeeping. First one is maintenance of the general cleanliness, ventilation, lighting, washing, etc. Then whitewashing once in a year. Then use of vacuum cleaner or by wetting process to clean the dust and other impurities from the industry. Then keep the protective equipment PPE in good working condition. Then all the things should be kept in the right things at the right place. In that principles has to be followed. Then both inside and outside of the industry or factory should be kept clean and tidy. Thus we can prevent a number of occupational diseases from that industry and factory. The fourth point is substitution. So replacement of the harmful material by a harmless one or a one with a lesser toxicity in the industry or factory is called as substitutions. For example, use of zinc iron paint instead of the lead paint. Lead paint is having more toxic to the employees than the zinc iron paint. Then use of chrysolite and amosite asbestosis instead of other asbestosis which cause the problem to the employees or workers. So substitution is nothing but a replacing. That is a replacement of harmful material or chemicals or anything in the industry or factory by harmless one or one with a lesser toxicity. Then fifth point is mechanization. So the industry or factory should be fully mechanized. The use of different machines to avoid the contact of the employees or workers with the harmful substance. So that means hand mixing. Mixing of the chemical or something in the hand must be replaced by the mechanical devices. So all the mixing should be done with the mechanical devices that will prevent the sources or prevent the chance for the occupational diseases to the employees or workers. Then proper pipe system in the industry or factory to convey the acids and other chemicals. That also will reduce the chance for the infection or chance for the chemical related hazards for the employees. So this is about the mechanization, that is application of different machines thus to prevent the direct handling of the chemical substance which cause a harmful problem to the employees or workers in the factory or industry. Then general ventilation, maintaining the general ventilation or adequate ventilation in the every room of the industry or factory. That is minimum 5 square feet for each worker employed in a room, that we call floor area. So floor area in the industry or factory must be 5 square feet per worker or per employee. Then according to Indian Factory Act, there should be 500 cubic feet air space, that is called cubic space for each worker. Space is, this is like if a person is standing that he should get adequate space for his normal breathing. That is according to Indian Factory Act, that should be 500 cubic feet air space for an individual worker or employee. So this has to be maintained in the industry and factory, that is called general ventilation. The seventh engineering measure is the dust control measures. Dust control can be done in the industry or factory with the use of wet methods, that is a damp dusting or damp methods, or by using water sprays. You can see the picture with the water sprays for the dust control. Then using dust-free grinding machines, serving systems, mixing machines, etc. So the dust control measures in the factory or industry includes wet methods of the dusting, that is damp method of dusting, water sprays for the dust to prevent the spread of the dust and exposure to the employees. Then using dust-free grinding, serving and mixing machines in the industry. These are the different ways to control the dust in the industry or factory. The eighth engineering measure is the use of protective devices. The protective devices usually includes personal protective equipment such as PPE, hearing protection devices, respirators and gas masks, and devices for monitoring the exposure rate of the different chemical agents that is emitted from the industry or factory. So devices for monitoring exposure. So first one is personal protective equipment, PPE. Personal protective equipment or PPE includes helmets, safety shoes, aprons, gloves, gumboots, goggles, barrier creams, etc. And all these personal protective equipment should be periodically checked and it should be kept in the good working condition or it has to be get repaired. Then regarding hearing protection, the use of ear plug, ear muffs, etc. to prevent the temporary and permanent deafness among the employees. Then use of different respirators and gas masks to prevent both organic and inorganic dust related pneumoconiosis. Then various application of various devices for monitoring the exposure of the chemical agents such as radiations, etc. that is emitting from the industry or factory. So all the employees or workers must be given the special instruction about the correct use of the various PPE devices, personal protective equipments and other devices. When it has to be used, where it has to be kept, where it has to be used, how it has to be used, and what kind of personal protective equipment has to be selected in during emergency situations. So when, where, how, what kind, etc. has to be instructed periodically to the employers and to the workers to prevent the occupational health hazards and diseases. The ninth engineering measure is the enclosure. Enclosure is nothing but covering. So enclosing the or covering the harmful materials which is used in the factory or industry to prevent the escape of its dust and fumes in the factory atmosphere which may cause the pneumoconiosis among the employees or the workers. So make a special enclosure. You can see the enclosure here, like covering the whole area where the dust is present. So enclosing the harmful materials to prevent the escape of the dust or fumes in the factory atmosphere. The 10th engineering measure is isolation. So isolate the offensive process in the separate building. So the process which may lead to exposure to the chemical, etc. such activities has to be separated from the main industry or factory or in the main infrastructure. So isolation of the offensive activities or process in the separate building, thus can be prevented the exposure to the number of employees and the workers. In addition to that, certain operation or activities in the industry can be done at night when there is less employees or work at night shift. So certain operations can be done at night in the absence of the usual number of workers and staffs. This is called isolation. The 11th engineering measure is the environmental monitoring. Environmental monitoring includes a periodical screening. So the screening of the environment of the factory or industry by a joint collaboration or cooperation of doctors and engineers in the industry and factory. Then periodically make sure the dust and gases which is emitted from the industry or factory with the permissible concentration. For example, permissible limit of asbestos dust is 2. So that has to be maintained. So make sure the dust and gas emitted from the industry and factory at the permissible concentration. Third is continuous monitoring of the factory or industry or the setting in relation to thermal environment of the industry, ventilation, adequate ventilation of the industry, adequate lighting facilities, etc. This all comes under continuous monitoring. The 12th engineering measure is the statistical monitoring. So all the data collected from the environmental monitoring has to be reviewed at a correct interval to evaluate the adequacy of the preventive measures adopted in the industry or a factory. Then if necessary, the preventive measure and methods has to be modified based on the statistical monitoring. The last engineering measure is the research, conducting continuing research. So research is conducted in the factory or industry for the better understanding of the environmental problems of the factory or industry. The aspects of research includes a study of the permissible limits of the exposure to dust, toxins or fumes from the industry or factory. Early detection of the various type of occupational cancer, pneumoconiosis or occupational accidents, etc. in the industry and the factory. Then application of new measures based on the research. Then application of evidence-based practice in the factory and industry, that is application of new measures in the industry for the prevention of control of occupational diseases and other occupational related problems in the industry and the factory. Now we can go through the mnemonic once again. That is mnemonic I have made for engineering measures includes designing local exhaust fan in housekeeping is a substitute of mechanical ventilation for dust control and it acts as a protective devices to enclosure the isolated environment is statistically proved by research. So we have discussed all the 13 measures under engineering measures, that is designing the building, using exhaust, local exhaust fan or ventilation, good housekeeping, substitution, mechanization, ventilation, dust control, protective devices PPE, enclosure, isolation, environmental monitoring, and statistical monitoring and research. The third measure is legislative measures. There are many laws and acts in India to protect and promote the health of the workers who are engaged in the industries or factories and to prevent the occupational diseases. So, in India we have many laws and acts to protect and promote the health of the workers or employees who are engaged in different industries and factories or work settings, thus to prevent the occupational health diseases or occupational diseases. Then safety at workplace is maintained and compensation to be given to the employees or workers if there is any accidents, any death or any occupational disease occurs at the workplace. Let us discuss what are the different laws and acts which protect and promote the health of the employees. There are mainly three important legislation in India to protect and promote the health of the workers or employees, thus to prevent the occupational diseases, that is Occupational Safety Law, Social Security Laws and Employment Order 2019. Occupational Safety Laws, Social Security Laws and Employment Order 2019. Occupational Safety Laws and Social Security Laws have been explained in detail and in depth in the video that I have uploaded, that is Public Health Laws and Classification of Public Health Laws. The content will be the same. So you can use the content for either in the prevention of occupational diseases or in the public health laws. So let us discuss in short what are the occupational safety laws. We have two laws. One is started in 1948, that is Factory Act, Indian Factory Act. Then second one is Mines Act 1952. Then under Social Security Laws, we have important three laws, that is Workers' Compensation Act 1923, ESI Act, Employee State Insurance Act 1948. Then we have Equal Wages Act 1976. So these are the important three acts comes under providing the security and safety to the employees at work settings. Then we also have the Employment Order implemented by Government of India in 2019. First is Occupational Safety Laws. In that Factories Act 1948. Indian Factory Act defines what is factory. According to this act, factory is an establishment employing 10 or more workers where power is used, electricity is used, and 20 or more workers where power is not used work together. That setting is called a factory. So according to Factory Act 1948, factory is an establishment employing 10 or more workers where power is used, electricity used, and 20 or more workers where electricity is not used is considered as a factory. So objectives of the Factory Act is, in short, to define the factory. Second one is to protect and safeguard the health of the employees or workers. So in short, Factory Act provide the facilities for the employees or workers like health, safety and welfare facilities, employment of a young person that is less than 14 years, working hours that is 48 hours, minimum 48 hours per week, leave with wages to the employee or workers like casual leave and leave, etc. and other leaves. Then prevention of how to prevent the notifiable occupational diseases and the criteria has to be maintained or followed when employee is working in a hazardous process. Then Act also mentioned about the penalties for the employer who are not providing such facilities to the employees or workers, like fine with imprisonment. Various depend upon the industries and factories. The second one is the Mine Act 1952. So objectives of the Mine Act is to provide health, safety and welfare of the workers in those who are working in the coal mine, metalliferous, other metalliferous mine, oil mines, etc. and to reduce the risk of occupational disease and injury in the mines. Then activities included in the Mines Act according to 1952. It has been mentioned the number of working hours of the employee in the mines. Minimum wages has to be given to the employee in the mines. Then regarding the regular conduct of the inspections or enquiries regarding the condition and the safety precautions in the mines. It also insists the organization of various seminars, conference on safety measures or on the safety precautions to the miners, those who are working in the mines. So these are the four important activities according to the Mines Act 1952. Act also mentioned the penalties for the employer, that is fine with the imprisonment. That also varies depend upon the situations. The second main act is Social Security Laws, providing security to the employees. It includes first Workers' Compensation Act 1923. According to this act, compensation should be provided for death, accident and handicaps which occur during the work for any employee. So compensation has to be provided for death, accident and handicap of the employees or workers occurs in the work setting. The Workers' Compensation Act clearly stated about the compensation for the employees or workers, that is for any injury in the occupational settings, any accidents, handicaps related to injury or accidents, any death in the occupational setting, or contact with any occupational diseases or pneumoconiasis. All these incidents the workers or employees may get compensated by the employer. The Act also stated the provision for the temporary disablement of the employee, permanent or total disablement of the employee, and in case of death, what will be the compensation for the employee. Then second one is Employee State Insurance Act 1948, Employee State Insurance Act. The objectives of the Act is to provide medical cash compensation to the workmen for any injury, delivery, disease or death, etc. The benefits or activities includes medical benefit, sickness benefit, maternity benefit, disablement benefit, that is any employment injury, any disability, that is disablement benefit, dependence benefit, if any death of the employee, that the relatives or dependents of worker or employee must be given dependence benefits. Then funeral expenditure has to be given by the employer through ESI. Then rehabilitation allowances and services to be given by the ESI Act. If the employer is not giving such a facility to the employee, then he has to be go for fine with imprisonment. That also varies depend upon the situation. Actually, the employer has to pay the contribution to the ESI Act, and if he is not paying that, there would be maximum imprisonment of 3 years and the minimum, that is 6 months with a fine of 5,000 rupees. If it continues, the minimum imprisonment will lead to 1 year and with a fine of rupees 10,000. The last one is Equal Wages Act 1976. So the objectives of Equal Wages Act 1976 is prohibit sex-based wage discrimination between the men and women. So equal services has to be paid equal amount. Equal responsibility has to be given or paid equal amount. So prohibit or stop the sex-based wage discrimination between men and women. Both should be paid in the same amount according to Equal Wages Act 1976. So that could be claimed through a labor welfare office or organizations. So through the labor welfare office or organization, employee can get certain concerns regarding his grievances regarding the occupational settings, any labor disputes occur in the occupational settings, any wages issues, salary is not given or it is pending like that. Then regarding any changes in the rate of pay or payment system, or hours of employment if it is more than 48 hours per week, or any changes in the condition of the work, any unsafe condition of the work, etc. all could be solved through labor welfare office or organizations. So this is about the Equal Wages Act 1976. The last legislative measure is Employment Order 2019. So Employment Order 2009 and Sectoral Employment Order 2019 set out minimum terms and conditions of the employment. Minimum terms and conditions for the better employment. It includes a pre-employment medical examination of the employees or workers. So conducting pre-employment medical examinations. Then provision for first aid and medical treatment for the employees or workers in the job setting. First aid and medical treatment. Then provision of quotas for the workers and other benefits for the welfare of the workers. Then regarding night work, the schedule of night work and provision for the night work, etc. also mentioned in the Employment Order 2019. Then it also mentioned about the child labor rules, etc. for the welfare and the protection and promotion of the employee. So the next session of the day is measures for health promotion and protection of workers. Measures for health promotion and protection of workers. There are mainly 7 important measures for the health promotion and protection of the workers. First one is regarding the nutrition or healthy or balanced diet for the workers or employees. The workers or employees should get a well-balanced diet and immunity boosting diet, that is vitamin C rich diet that increase the resistance power of the employees or workers. Thus it helps to prevent the pneumoconiosis, other occupational diseases. Then prevention of communicable disease and control of communicable disease which occurs in the occupational settings. Then environmental monitoring and environmental sanitation of the occupational setting or in the factory or industry. Then maintaining the and promotion of the mental health of the worker or the employee. The goals of mental health includes to promote the health and happiness of the workers and his family. Then early detection of the signs of stress and strain and take necessary measures to solve the stress and strain of the employees. Then provision for treatment of employees who are suffering from any mental illness in the occupational settings, and rehabilitation program of the workers who become ill or disabled in the occupational setting. Then health education regarding the situations, regarding the problems, regarding the safety measures in the occupational settings, and special measures and facilities for the women and children like crush, having crush, educational facility, maternity facility, etc. for the women and children, and free education for the children, etc. and regarding family planning and family welfare of the employees and workers. So these are the 7 important measures for the health promotion of the employees or workers. First one is nutrition, second one is prevention and control of communicable disease, third one is environmental monitoring and sanitation of the work setting, then mental health of the employee, health education, counseling, etc. Special measures for women and children, and family planning. So far we have discussed about the prevention of occupational diseases and measures for health promotion and protection of the workers. Hope this video really benefits in your studies. If you feel it is worth and benefit, please like, share and subscribe my channel, and stay tuned with Angel Health Academy for the last part of the video of occupational health nursing, that is roles, responsibilities and functions of a community health nurse in occupational health nursing. Thank you.